Am I audible? Is my screen visible? So in today's topic, we will be learning about cleaning, sterilization, and disinfection. Those who have the textbook, please mention the page number in the chat box. So cleaning, this is the process of removing any foreign material like soil or any organic material from any hospital objects. Okay, usually the ones which we use in operation theaters and all. So that will get organic materials as well. Any soiling, usually with water and detergent, is used for the cleaning purpose. And cleaning is very important. Right before you send this equipment for high level disinfection or sterilization, cleaning is very important. Okay. All the inorganic, organic materials that remain on the surface of the instruments, that will be removed. Otherwise, it will interfere with the effectiveness of processing. Okay. So there are four types of cleanings: manual cleaning, enzymatic cleaning, ultrasonic cleaning, and automated washers. Okay. In manual cleaning, all the surfaces, channels, boards, or instruments must be cleaned. You have to wear PPE, personal protective equipment, while cleaning. Okay. And the main thing here is you want to remove all the gross materials, all the gross soiling using a tepid water, which is 15 to 18 degrees. Okay. Celsius. If there are any equipments which requires deconstruction, part by part, remove it, immerse all those parts fully in warm water, which has biodegradable, non-corrosive, non-abrasive detergent. Okay, detergent should be used in the water, but it should not corrode or be abrasive on this equipment. Part by part, remove the equipment and immerse all these parts in this water solution, water detergent solution. All the visible soil should be removed. Okay, and dry all the parts, dry the instruments before you send it for further processing. That is manual cleaning. It takes time. Then you have enzymatic cleaners. So if you are using any fiber optic instruments which you use for procedures like colonoscopy, spondyloskopy, laparoscopy, all these fiber optic instruments should be cleaned using enzymatic cleaners. Okay. Enzymatic cleaners are very hazardous. If you come in contact with them skin to skin, okay, it's very hazardous. So you have to, whoever is doing the cleaning using enzymatic cleaners, they have to wear this PPE like this. Okay. That bottle you can see there that contains enzymatic cleaner, and the person who is operating with the enzymatic cleaner should be wearing PPE. Okay, because it is very corrosive to human tissue. Then you have ultrasonic cleaners. These cleaners don't disinfect the instruments, but they create this high frequency, high energy sound waves, which when it hits the equipment, because of the sound waves, whatever is attached to the equipment, dirt, soiling, tissues, whatever, okay, that will drop off. And because of this, it makes the rinsing process very easy. Sometimes when you rinse with water and detergent, it's not enough. Okay. So in that case, whatever is stuck to the instrument, so that it falls off from the instrument, ultrasonic cleaners are used. They don't disinfect, they just make sure the soiling detaches from the instrument. Okay. Any instrument that is cannulated, which has hollow bores, plastic, made up of alloy of two or more metals, glass, syringes, lenses. For that, these kind of instruments, ultrasonic cleaners are not used. Okay. Daily efficacy test should be done when you're using ultrasonic cleaners. This is how ultrasonic cleaner looks like. Okay. They don't disinfect, they just ensure that soiling and any organic compound is there on the instrument. It should fall off. Okay. Then we have automated washers for cleaning basic instruments. It cut down the time of handling each instrument, and when whoever is using it, they must be compliant. And on the automatic washers which you have purchased, that should also be compliant with the national guidelines and standards, and use it according to the manufacturer's instructions. So this is how automated washers look like. They just make manual cleaning simpler. One by one, you don't have to clean the instrument. In one go, many instruments together can be cleaned, so that it saves time, energy, and manual labor. Okay. Then sterilization, that is a process which will destroy and eliminate all forms of microbial life, and it is carried out in any healthcare facilities which will demand physical or chemical method. Okay. And all the materials which undergo sterilization should be wrapped properly. Only wrapped or packed materials is described as sterile. Okay. You have to ensure that the instrument can withstand the process of sterilization. The instrument has been adequately cleaned. Instrument does not require any special treatment. And records of the sterilization process, each and every sterilization cycle should be recorded. Okay. Because if at all you understand after the sterilization that it was not adequately sterilized, those instruments can be called back. So different methods of sterilization, you have steam, autoclave sterilization, hot air oven that uses dry heat, ethylene oxide, automated chemical systems, irradiation. These are the different types of sterilization methods. Autoclave is the most common one. So autoclave, it's a device that sterilizes instruments or other objects using steam under pressure. The length of time required for sterilization depends on temperature, vacuum, and pressure. So most efficient and reliable method to achieve sterility of instrument and equipment is autoclave or steam under pressure. So these are the four major principles which you have to use while using steam under pressure or autoclave. Steam, temperature, pressure, time. Okay, these are the four main principles. So the types of autoclave, four major types are there. Downward gravity. So sterilization of waste, solutions, instruments, anything that is liquid, that can be also sterilized using the downward gravity sterilizer. Self-contained for office-based small quantities of or simple items, okay? Artery forceps and all that. Any form of shuttle forceps you have to sterilize. Okay, on desktop you can do. Benchtop also it is very similar. You don't have to wrap it, but soon after the sterilization, immediately you have to use it. Okay, so in OT, yeah, emergency department, ICUs, okay, they can use benchtop sterilizers. Okay, you don't have to waste time for wrapping it, but it will give you sterilization. Immediately you have to use the instrument. You can't keep it for future use. And pre-vacuum, it cannot sterilize any liquid, but any gowns, towels, clean instrument. For that, pre-vacuum sterilizer or autoclave can be used. Dry heat sterilization. It uses high temperature to kill microorganisms and bacterial spores. And hot air usually destroys the pathogens by the process of oxidation. It burns up all the bacterial cells. And it is used on items that cannot get wet, such as powders, oils, and all. And the door unit should not be opened when the sterilization cycle is ongoing, because the outside air is cold and the inside air of a hot air oven is very hot. If you immediately open the door soon after the cycle or in between the cycle, all the glass items can break because of the sudden shift in the temperature. Okay. You cannot use it for things that are liquids and all. Okay. So this is how a hot air oven looks like. Then you have ethylene oxide, EO plant. So that is used for sterilization of instruments or equipments made from heat labile materials or those devices that contain electronic components. Okay. So any equipment or instrument which has battery inbuilt batteries in it, or any circuits inside it. Okay. For that, ethylene oxide is ideal. Okay. Time required to process the instrument is dependent on the temperature, humidity, and concentration level of gas. If the concentration level of gas is very high, in a very less time, sterilization can be achieved. But the concentration of the gas, if it is very low, you need more time for the sterilization to be achieved. And this ethylene oxide gas should penetrate each and every part of the packaging. Otherwise, it is not adequately sterilized. It will take 12 to 24 hours for one cycle of ethylene oxide sterilization. And it's a very toxic gas. Ethylene oxide gas is very toxic. So usually in healthcare facilities, we don't recommend this. Okay. For industrial plants and all, ethylene oxide plants can be kept. Then you have automated chemical systems. So hydrogen peroxide plasma, that is one type of automated chemical system. Low temperature, low moisture sterilization within 45 to 80 minutes, quick. Okay. And packaging also should be done here with non-cellulose polypropylene wraps is used. Then peracetic acid plasma, that is another form of chemical system. Again, low temperature, low sterilization methods. Any instrument which cannot withstand high temperature, high pressure, or high moisture, those can be used here. Okay. 25 to 30 minutes it will take. Then automated chemical systems. These are how it looks like. We have irradiation, uh, gamma radiation or ultraviolet radiation can be used. And this is used in commercial facilities, not in healthcare facilities. Okay. So what it does is, it will convert the microorganism into a nanoparticle. And once the microorganism is converted into a nanoparticle, it no longer can infect anyone. Okay, so that is how radiation helps in sterilization. Packaging, materials which you use for packaging or wrapping before sterilization, paper-based, non-woven materials, or even containers as a whole, okay, can be used for packing. Containers are usually used for surgical kits. You have quality control parameters in the checklist: load number, load content, temperature, time of exposure, physical or chemical testing, biological testing, regular engineering and maintenance documentation. These all are the parameters that the quality officer or the infection control officers should check in the CSST. Okay. Does each cycle of sterilized instruments, do they mention these things on the label, on the sterilization label? Okay, the load number, whatever was inside the load, temperature at which it was operating, time of exposure, and chemical testing and physical testing we'll see now. That's when you will understand. Okay, the results of it should be there on the load. Coming to disinfection. Disinfection is a process that eliminates most or all pathogenic organisms except bacterial spores. So the disinfection is usually accomplished using liquid chemicals. High-level disinfection is capable of killing bacterial spores when it is used in sufficient concentration for a required amount of time. And disinfection is not a sterilizing process. High-level disinfection should not be substituted with sterilization. Whichever instrument can be sterilized, it has to be sterilized. Only if the instrument cannot undergo any procedure of sterilization, that time high-level disinfection is done. So high-level disinfection, it destroys all microbes except some bacterial spores. Okay, so glutaraldehyde 2%, ethylene oxide, okay, they come under high-level disinfection. Intermediate disinfection, it inactivates Mycobacterium tuberculosis as well, most viruses, fungi, okay, but it will not kill all spores. Okay, so any form of alcohols, ethanol and all that is used in the hospital, chlorine-based components, hydrogen peroxide, chlorhexidine, glutaraldehyde, okay, they all come under intermediate disinfection. Low-level disinfection kills most bacteria, some viruses, but it cannot kill resilient bacteria. Okay, so soaps that you use, hand wash soaps, hand rubs, and everything that is used. Okay, so that's a low-level disinfection. Then methods of disinfection, you have thermal methods and chemical methods. Thermal methods, it can withstand the process of heat and moisture, and things that does not require to be sterile, in that thermal methods can be used, but it is used in hot water. Okay, disinfection in which hot water is used, okay, or a heated environment is used. Chemical disinfection, again, that depends on temperature, contact time, concentration of the detergent that is used or the disinfectant that is used, pH, presence of inorganic matter, organic matter, resistant bioburden, that is the resistant bacteria which is there. Okay, so based on all these information, a chemical method is chosen. Surface temperature, when the temperature is high, you don't have to keep it for a long time. Here you can see when the temperature is 90 degrees Celsius, the minimum time of disinfection required is just 1 minute. As soon as the temperature goes low, like 70, you have to keep the item for 100 minutes. That is more than an hour. Okay, 1.5 hours approximately. So the higher the temperature, the less will be the time required for disinfection. High-level disinfection, it inactivates all microbial pathogens except where there are large number of bacterial spores. In intermediate disinfection, it inactivates all microbial pathogens except bacterial spores. Low-level disinfectant, it will rapidly inactivate most vegetative bacteria as well as medium-sized lipid-containing viruses, but it may not destroy spores, mycobacteria, fungi, or small lipid viruses. Okay, so this is how you can classify a disinfectant. Okay, are they able to kill the spores, inactivate the spores, or not? Okay. Glutaraldehyde is generally the most appropriate disinfectant that can give you high level disinfection. Okay, and this must be used under very strict controlled condition as well. Glutaraldehyde 2% is the most potent form of disinfectant. Okay, and you just require 20 minutes of immersion time. Okay, it can achieve high level disinfection in that time. And meticulous mechanical cleaning is required before you immerse any equipment or instrument in glutaraldehyde solution. Okay, properly manual cleaning has to be done. Okay, instruments that are already dirty, soiled, and they have organic compounds stuck to them is not ideal for glutaraldehyde solution. You have to clean it well. Manual cleaning has to be done properly before immersing any instrument in glutaraldehyde 2% solution. So these tables you can go through. It's there in your textbook as well. Sodium hypochlorite 1% dilution. 1% means 4 part of water, 1 part of chloride. Okay, that is 1:5%. Disinfection of any item that is contaminated with blood or body fluid. Okay, any instrument that is contaminated with blood or body fluids, we can use sodium hypochlorite 1%. Bleaching powder 70% chlorine. Okay, that is used for toilets and bathroom cleaning. Okay, alcohol 70%, that is your spirit, surgical spirit. Okay, smooth metal surfaces, tabletops, any surfaces where you cannot use bleach, where you cannot use chlorine based substance, there ethanol surgical spirit is ideal. Okay, detergent with enzyme, if you want to clean any fiber optic instruments, endoscope, laryngoscope, sigmoidoscope, colonoscope, okay, laparoscope. So all these fiber optic instruments, if you have to clean, detergent with enzyme is the ideal solution. Okay, but manual cleaning before that is very essential. Then chlorhexidine based components, that is antiseptic, that can be used on skin. Okay, disinfection of hands, any part of your body which is going to be operated before operation to clean that area. Okay, spirit can also be used. Soap can also be used. But ideally, chlorhexidine, if it is there, go for it. Okay. Ammonium-based compounds are used as an antiseptic for cleaning dirty wounds. It can be combined with chlorhexidine as well. Okay. And this is used on living tissues. Bleach and all you cannot use on living tissue. Okay. That's a difference.